All right, gentlemen, we are talking to you this morning, or maybe wives or women, if your men have these kind of problems, you can clue them in, but we're talking about prostate health, because it's a very serious topic, and Dr. Andy's going to talk a little bit about some of the problems and how you can diagnose that.
It's very serious and very common. Most men by the age of 60, that about 50%, and these days 60 is pretty young. By the time 85, 90% of men will have problems with their prostate.
Wow, that is a significantly large number. So is there like a one telltale sign that alludes you to what's going on, or is it hard to diagnose?
Well, the most common thing that's going on, what we're talking about this morning, is what's called benign prostatic hyperplasia, and that's just a fancy medical term for prostate enlargement. And the prostate sits right under the bladder, and the urine has to pass through the prostate on its way out. And so when the prostate gets big, it interferes with the flow of urine. And so those are where the symptoms come in. Men have difficulty either going to the bathroom, starting their urine stream, stopping it, maybe feeling they have to get up in the middle of the night, not being able to hold it. I mean, these are problems, as any woman who's dealt with incontinence knows. Same thing as for men. It's very embarrassing and very difficult to talk about.
And because it's embarrassing, do you think people are hesitant to go see their doctor or get treatment?
Absolutely, absolutely. Almost every time a patient of mine and I will talk about prostate issues, it turns out, usually in hindsight, that they've had the issue for a while and just never really wanted to bring it up because they were embarrassed.
Is that a danger in holding back and seeking help? Can you damage those organs?
You can actually, not very often, but because most people get treated before that. But there are some serious consequences of long-term untreated prostate enlargement, what we call sort of an acute urgent situation where the urine is simply held in the bladder, and that obviously can cause a problem that's treated in the emergency room usually, or in the hospital.
That doesn't sound like fun at all. So it's simple treatment? Can you just take a pill or a medication? Or?
Well, people often, there are several good medications out there that can be used and are very effective. There also are some various surgical procedures that are a little more effective but more invasive. People hear of the Roto-Rooter procedure called TURP. Well, that's a little bit more in the older days, a few years ago. Now they have many newer, less invasive laser and other types of procedures that can help as well.
So if you have a prostate problem, is it something you'll have lifelong, or can it be treated and fixed and you're done?
It's usually treated, and it's something that you'll continue to be treated for lifelong, or you have a procedure for, and then it won't become an issue again for many, many years, if ever. But the bottom line is it can be treated, and the hard part is just getting men to come out and talk about it.
Right, and go get treated, because it'd be much simpler to just get on a proper regimen. If you have more questions, you can get a hold of Dr. Andy by giving him a call, 694-6246, or email him, draol@phc-md.com. Thanks so much, Dr. Andy.